Hello, my name is Sharon Broho, and I'm Senior Clinical Education Specialist for Healthmark, a Gettiga company. We're going to be talking about electrical strays, insulation and continuity testing for insulated instruments and cables. The objectives, we're going to really look at failure rates identified in a 21 to 2022 case study of insulated instrumentation and cables. We're also going to review the ANSI AAMI ST79 2020 amendments that supports insulation and continuity testing. We're going to identify the different types of damage to the insulation and the root causes, while pinpointing methods to protect insulated instrumentation and devices throughout the whole process. We're also going to be looking at best practices for building and maintaining an effective verification testing program within your department. For the description, in recent years, there's been documented cases reported in the FDA mod reporting system. And this has shown patients have suffered serious injuries and even deaths associated with damaged insulation in electrosurgical instrumentation and cables. The lack of emphasis on inspection, insulation, and continuity testing has led to the oversight regarding the variety of electrical surgical devices, from bipolar forceps to cables and cords, and also the range of sensitivity in insulation testing equipment available on the market today. There are many types of insulated instrumentation and devices used for a variety of procedures, and that can range from plastic surgery all the way to just laparoscopic. But if you have any of these types of instrumentation and devices, you want to make sure you have the right tester and the right accessory to be able to test effectively. In the previous slide, you saw the different types of insulated instrumentation devices. Now you can see in this slide what type of damage that can happen for those specific insulated instruments. For the bipolar forceps, you can see there's a nick. The bipolar scissors, you can see there's a gouge. For a laparoscopic shaft, you can see at the distal end that it's peeling away and it's scratched. For the monopolar cable and cords, you can see there's a big nick towards the proximal end where it hooks up to the equipment. And then here's another cord, bipolar, where it's actually split halfway through the cord. And then a laparoscopic insulated handle, where you can see at the very distal end of that handle, there's a big piece of insulation missing. In the FDA mod reporting system, there were adverse events. In July of 2021, an insulated laparoscopic handle was found to have an insulation integrity failure, and it was reported that the product arced, resulting in blisters to the patient's skin. August of the same year, an insulated laparoscopic cautery probe was identified with damage to the insulation coating, and the instrument melted and arced from the side, burning an unintended portion of the liver. In March of 2022, a monopolar cable reportedly exploded during the procedure, burnt towards the end where the cord connects to the generator unit, and a minor deformation or kink was noted on the cable.
Danger, stray
In the
energy
video,
burns.
you can see
We've
targeted tissue being cauterized on the top left, but on the bottom right, you can see there's an electrical stray burning the bowel. In this video here, you can see that on the far bottom right, that there's an electrical stray burning a portion of the liver, which is really bad.
Danger, stray energy burns. We've agreed.
So objective one, let's go over the failure rates identified in the 21 to 2022 case study on insulated instrumentation and cables. So this study was a retrospective cross-section 12-month study that was conducted from May of 21 to May of 2022 at 49 healthcare facilities that consisted of 416 insulated instrumentation. So for the methods, it was an auditing of random laparoscopic insulated trays, bipolar insulated forceps using an insulated tester with of variable power settings, and a variety of adapters to fit the instrument being tested. A cable continuity tester was utilized to identify any disruption of the electrical current within the reusable monopolar and bipolar cables. An enhanced inspection microscope was used to evaluate the damage identified with the insulation tester and other visible damage observed. And just as a side note, personnel at the facility during the study were notified of the failures. To continue with the methods, a qualitative survey question was administered to operating room nurses randomly across the United States, asking if they had experienced any such events of arcing of electrical current during a procedure. In addition, the FDA mod reporting data system was searched for adverse events on insulation failures reported within the same time frame of the study to determine if there was any significant patient risk that existed. Now, for limitations, the inconsistencies between each facility's insulation inventory and the amount of insulated laparoscopic instruments within a tray skewed the percentage of failures. The amount of insulated bipolar forceps the facility could afford to release to test was another factor and made the sample size a little smaller. There were also inconsistencies with not all the facilities using reusable cables and cords and resulted in single use, or they may have a mixture of both, which affected the sample size for that category of instrumentation. So let's go right to the results. Of the 416 instruments tested, 223 showed failures on insulation testing or even inspection, as noted here on the graph, with 16 facilities showing a failure rate of 75% to 100% of all devices tested. On average, insulated cables demonstrated a 6% fail rate for continuity across 32 facilities. Even though it's only 2 or 6%, it only takes one to cause an OR fire, which, if you don't know, in the FDA mod reporting database system, there were a lot of fires and burns contributed to monopolar cords. Bipolar forceps had the highest fail rate, with 27 facilities having a 75 to 100% failure rate for those devices. In one of the 27 facilities, 19 insulated bipolar forceps were tested from ready-to-use backup inventory. 13 of the 19 were identified as having insulation failures. 8 damaged insulation forceps came out to 42% with arcing. 5 were damaged. They passed the insulation tester, but had visual damage to the insulation itself at 26%. And then 6 passed with no damage at a 32%. Now for the survey, a total of 66 responses were received by respondents. And if you look here, a little over 42% said yes, that they had experienced some type of malfunction during a surgical procedure using an insulated instrument or device. So let's discuss the contributing factors from the study. The results shown revealed that there were numerous contributing factors to unnoticed insulation damage. The factors included inadequate magnification to clearly identify the damage. For example, they only had standard lighted magnification like a desktop, and not enhanced magnification microscopes to visualize at a higher magnification. To give you an idea, a desktop magnifier can range between 1.8 to 2 times the magnification. Enhanced inspection microscopes start at 10 times the magnification all the way to 230 times the magnification. Also, insufficient insulation testers lacking the sensitivity and the ability to test a wide range of insulated instrumentation. For example, bipolar forceps, damage and missing accessories were also noted in the department. So to give you a better idea, insulation testers out there can range in sensitivity, sort of like driving a car. A car can range from a Toyota all the way down to a Tesla. Insulation testers are similar to that, meaning you could have something that's pretty basic, that has a very low sensitivity, but then you can have something that you actually have to set the voltage to a specific range to an accessory for the type of insulation that you're testing. And lastly, there was a lack of education for technicians in identifying damage and the operation of the tester itself. To go on to contributing factors, there were deficient containers housing insulation laparoscopic instrumentation, or correct containers, but they had overflow of insulated devices on the bottom that were being damaged by the metal instruments. In this picture here, you can see that the distal ends of the instruments of insulated devices are actually being damaged. But if you look a little closer past where it's circled, you have towel clips that could actually cut in the insulation itself. There was also inappropriate storage for backup insulated instruments. For an example, some of the bins were too small, or they have excess amount of instrumentation, and then they had in areas of very tight spaces. There was also an insufficient repair service for insulated devices. So for an example, they had poor repairs. Not that maybe it wasn't even in the contract to even look at the insulated devices, only the metal instruments that were within the tray. And also, they were not frequent enough for the repairs. So now let's go into Objective 2 and review the ANSI AAMI ST79 2020 amendment in this new section 8.2.1. In the new section, in 8.2.1, under Inspection of Instruments Intended to be Used with Electric Current, it states that instruments should be organized and protected from damage. As you can see here, the tray looks really organized. The issue lies is when you have metal, as you can see where it's circled, where the towel clips are scraping against the insulation of those shafts. So it really helps to have your insulated items separated from your metal instruments. It goes on to say that instrumentation intended for use with electric current should be tested for integrity each time it is processed. It also states that each insulation tester may be supplied with a variety of accessories to test specific instrumentation and cables and cords based on their design. Cables and cords are also a source of concern and need to be inspected and checked for integrity and continuity. So let's break down what AAMI is actually stating in regards to integrity. Integrity would be the outside of the cable and cord, like you see on the pictures on the bottom right, where the cord is grounded, it's put in through this specific wire tester, looking at the different diameters. As you can see, there's 3 listed, and then you find the right fit, and then you turn on the insulation tester to specific voltage, and then you run the cable through it, and then if there was any nicks in that cable, it would actually alarm. In regards to continuity, as you see the pictures on the left, this is going to mimic the generator unit. So what you would do is you would plug in the proximal and the distal end of the monopolar cable, and then you would see a light go on. When the light goes on, that means there's a connection, but you also have to wiggle and play with the proximal and distal end as well as the whole cable itself. And what you're looking for is for any flickering. Like the picture on the right, you can see it went off. So there was some break in there. So if there is a full break, the light will never go on. If there is a half break or multiple half breaks, that's when the light will flicker. The cable continuity tester, or the continuity itself test, can actually do bipolar cables and cords as well. AAMI goes on to state that insulation should be checked at appropriate inspection points for the instrument. See Table 1. And what's really nice on the far left is Table 1 goes into the instrument and device to be inspected. For an example, laparoscopic including robotic, insulation forceps, bipolar forceps, insulated scissors, cables and cords, and even LEAP instruments. The next column goes in inspection points. And some examples here would say maybe the shaft. It would go into the forceps shaft sides. It would go into the handles, the blades, and also the full instrument itself. Possible damage can range from the distal tip, frays at the distal tip, or at the proximal end in separations, shaft nicks, and cracks. And the methods to assist with the inspecting and testing can vary based on the instrument itself. And some of the items listed under this section are installation tester, lighted magnification, enhanced magnification microscope, visual inspection, and tactile inspection, which would be using your hands to feel if there's any damage on that shaft or insulated instrument. In figures 1 through 5, this is the first time AAMI actually came out with pictures in color. And what's really nice is that these pictures, figures 1 through 5, match the table 1 of different things that could happen to the insulated device in regards to damage. In this table 1, it goes on to say that laparoscopic, including robotic instrumentation, as well as methods to assist, enhanced magnification microscope. Insulated forceps is also listed, and it says bipolar forceps as an example. And you can see here in this picture on the very bottom that there could be a lot of issues with insulated bipolar forceps. The instructions for use were also reviewed for bipolar forceps. And you can see some of these quotes from the IFUs where it says examine insulated bipolar forceps for integrity, observe for cuts, gouges, or any exposed metal, inspect for cracks, tarnished surfaces. And then it also states that fires involving surgical drapes and other combustible materials have been reported. For IFUs for laparoscopic instrumentation, specifically the shafts, it didn't really state anywhere in the documentation to inspect for damage or even test. But again, there's a lot of IFUs from different vendors that may have a little bit more in-depth direction. The IFU for monopolar cables and the one that was reviewed, it stated it recommended to establish a procedural review by which the cord's electrical continuity is regularly tested with an ohmmeter, which the picture on the bottom would be a cable continuity tester, as well as a frequent inspection of the cord's insulation before and after each use. So let's go on to objective 3 and identify the different types of damage to insulation and their root causes. So if you look at tray setup and the decontam staging, these are definitely bad practices. So the picture on the left is a reusable bipolar cable that's mixed in with metal instruments, where you can see where it's kind of highlighted where the scissors can definitely scrape and cut that. Now beyond that, you can also see a light cable in there that's probably getting damaged as well. In the middle picture, you can see metal instruments, and this is in decontam staging, are put on top of the laparoscopic instruments to hold them down for probably heavy impingement in the washer. The problem is that those metal instruments are banging against those insulated shafts, and they're cutting them and damaging them. The picture on the right is a tray setup, and again, a prime example of trying to separate your metal instruments from your insulated instruments, where you can see the tip of those metal instruments are scraping against those insulated shafts. Backup bad practices, where you can see the picture on the left, that's just so much going on there. And not only is it too many insulated bipolar or bayonet forceps, they also have mixed metal ones in there. The picture on the right, that's an excessive amount of insulated laparoscopic instrumentation. So if you're needing one that's in the back, you're having to pull everything else, and other instruments are scraping those shafts. So I would really advise to look at your inventory and trim it down a bit and get rid of instrumentation that's not being used, and maybe get more of the ones that are being used. Repair bans is a big issue because you're sending out instrumentation that have damage to that insulation itself. But when you have so much like this in a bin, now you're causing more damage, possibly not even to the insulation, but to the distal end or even the handle of the instrument. So I definitely recommend separating your damage insulation by maybe category. Like maybe forceps would be in one and it only holds maybe 10, and then you send it out, and then separating your forceps and other insulated devices. Now, in post-operative staging, this is definitely bad practice, and there's a lot going on here, from the rigid endoscope to even the camera. But the focus here is rarely the insulated laparoscopic instrumentation that's on the bottom, and it's scraping against all the other metal instrumentation. So here are different pictures of bad repair services, meaning that it was overlooked in cases. For an example, in the picture on the top left, where it's actually receding back, and that's not good, and this was overlooked by the repair service. And the picture in the top middle and the top right, this was education as well as insufficient repair service, where it was being pulled back, but the staff didn't know that that was a bad thing, that they were focusing on the testing of the shaft, but not looking at the distal end of it. The picture on the top right was overlooked with not having the right magnification, so they didn't have a microscope, they had a desktop magnifier, so they didn't even know the damage was even there. The bottom left, where the proximal end was overlooked by the repair service, as well as the staff didn't know that there was even damage at where the handle meets the shaft. In the middle bottom, there you can see a pinhole in a bipolar forceps that was overlooked, again going back to not having the right magnification. The bottom right, this is old damage. You can see hard water building up where the shaft insulation is backing away from that distal end. This was a lack of education to be able to know that this was actually a bad damage insulation. Using the right tools to clean is really important. In the picture on the left, this is actually using a metal brush, which is not good on insulated devices. So what that does, it takes off the bioburden. The problem is it also takes off the insulation, which causes fragments that can actually go into a sterile cavity. In the middle, this is a combination of using a Bovie pad from the OR and a metal brush. And again, this is not correct, and you can see that it's causing grooves and gouges within the insulation that now is going to be an area of concern of keeping back debris. The picture on the right, again, a prime example of using a metal brush where you can see the frayed insulation that could possibly go into a sterile cavity. The insulation handle, if you do have this, because they do come metal as well as plastic, but in insulated handles, you can see in the picture on the left, this is a complete split. The picture in the middle there, the insulation actually came off in my hand. The picture on the right, you can see that it's exposed metal here. This would not only catch the drape on fire and possibly burn the patient, this can actually burn right through the surgeon's glove. In regards to insulated bipolar forceps, the picture on the left there, you can see there's two significant cracks, and you can see where it's raised up, and that's actually the weakest part of the bipolar forceps is the base, because typically you'll have two metal tines, which are each end of that forceps, into a plastic base. You can also see in the same picture there's a pinhole right in the insulation in one of the tins. The picture in the middle is a cut from probably another instrument from staging, and you can see lines going up and down the insulation, probably from a metal brush. The picture on the right is that base, which is again the weakest part of an insulation forceps, but in this case it's the base that split all the way down, which can harbor debris. So let's talk about Objective 4 and discuss best practices for building and maintaining an effective verification testing program within your department. So you really need to have the correct accessories, meaning for the first slide that we looked at, were all the different types of insulated devices and instrumentation, you got to be able to test those with the correct accessory. Or an insulation tester could have the correct accessory, but it could be more cumbersome to use. Having the correct tools, for an example, the correct insulation tester, enhanced magnification like we talked about to be able to see that damage to investigate root cause. And then making sure that you have no damage insulation testers, accessories like you see in the pictures on the bottom there where it's all frayed with a wire brush, as well as LS ring. You can see the holes a little bit bigger than the picture on the right to it, where that is a brand new one. And then repairing your own tools, which is not good. And in this case, they're repairing the grounding cable, and you can actually hurt yourself. And then also making sure that your tester is not overdue for maintenance. And typically they can range between 1 year to make sure they're recalibrated. To continue with that, having enough insulation testers in your department, having them per workstation, or if you have 4 workstations, but really you only use 2 of the workstations to do installation trays, then you would need 2. You also want to have effective initial and annual education, not just initial, where maybe you forget in over a year, or maybe you weren't even there for that specific initial education, and you want to have an ongoing one annually. A more insensitive insulation tester with a variety of accessories to meet your insulation inventory needs. And be familiar with the ANSI AAMI ST79 Amendment 2. We just touch on highlights of the document, and that specific section is actually 6 pages long. You want to collaborate with and educate your surgical team and your infection professionals in making sure they understand what your needs are. You want to also interview and do periodic audits within your repair service and ask what they look for in damage for insulated items and what is the frequency for that. Please visit Healthmark's YouTube channel for the McGann Insulation Tester tutorial and the Continuity Tester tutorial. Thank you.